Well, joining us today is Dr. Jean Walrond, the president of the Sickle Cell Foundation of Alberta. Dr. Walrond, I want to start with just you giving a little bit of background on the Sickle Cell Foundation itself and a little bit of the science behind what exactly is this disease.
Okay, our organization was founded in 2002 by two young people who were attending the University of Alberta at that time. And it is set up primarily to help educate stakeholders and the community at large about sickle cell anemia. It's also to advocate for the needs of sickle cell patients and also to sort of create awareness. So our three prongs are education, awareness, and support. Sickle cell anemia was discovered in 1901 by a young man who was studying dentistry in Chicago. And what it is, it's a blood disorder that affects people, say, from the African continent or in the diaspora, people from around the Mediterranean Sea, Greece, Portugal, Italy, and so on. Have you ever heard of thalassemia? Neither? Okay, so what it is with respect to sickle cell anemia is the layman's term will look at it this way. Normally, your blood cells are disc-shaped, the red blood cells. Well, with respect to sickle cell anemia, it's almost like a curved C. So the people who have sickle cell anemia will find that their blood cells do not last as long as the regular person whose red blood cells last for about 60 days. In addition to that, they get a lot of pain in their joints and along their back, and also different organs of the body. They are susceptible to things like pneumonia. And it's a good thing that you're asking me about sickle cell anemia right now, because some of the effects of sickle cell anemia are similar to COVID. So things like your acute chest syndrome, where you have trouble breathing, pneumonia, and lots of respiratory illnesses are similar with respect to patients with sickle cell anemia. So right now, because of COVID-19, we are very much concerned about patients who have sickle cell anemia, simply because their illnesses are similar to COVID.
And if people want more information about the foundation itself, where can they go find that?
We have a very nice website, very educational website. We get lots of information every month from we call it Grady Hospital in Atlanta, Georgia. So we have the most current information about sickle cell anemia on our site. The next thing that we're looking for is, in order to do our programs, we would like to increase our funding stream. But the most important thing, if you can do nothing else, we would like you to go to your nearest Canadian Blood Service and become a regular blood donor. The Canadian Blood Services call it Partners for Life. And we're looking for young people between the ages of 18 and 35 to become Partners for Life. Because when you start understanding your genetic makeup, people who are very closely related to you genetically provide the donor and the recipient will have less incompatibility with the blood products that they receive. But we are encouraging everyone between the ages of 18 to 35 to become regular blood donors or Partners for Life, because the Canadian Blood Services always need blood. And when you visit our website or you call in to become a regular blood donor, tell them that you're donating this blood for sickle cell patients. What they do with the blood is they give it a number, and then we can know that it is for sickle cell patients. It's very important because if you have to get 8 pints of blood every 3 to 8 weeks, sometimes we have to go outside of Alberta to get this blood. What we are striving to do is to have Alberta become a blood donor, or have extra blood that they can give out to other different provinces or countries, as opposed to having to go out to look for blood for the patients here.
Well, Dr. Walrond, I really appreciate your time, and thank you so much for joining us today.